Welcome back. Dr. Bartholin here. Chapter 138 focuses on Bartholin gland, cysts, and abscesses. What is a Bartholin gland? Bartholin glands are usually what you see are their paired glands, and they are glands that become active in puberty. And what they do is they secrete mucus through their narrow ducts, and this lubricates the vulva. And these glands are generally not palpable unless a cyst or abscess develops, and that's when you see your client. Bartholin glands are related to ductal obstructions when this happens, and it occurs when you have inflammation, mucus, or something that is congenital, even narrow pathway of the duct is present. The mucus that lubricates the vulva then is impaired. Bartholin gland abscesses are a result of acute infection that's followed by obstruction. And you see Bartholin glands occur most often in women of reproductive years, and they will seek treatment. The definition is that it's usually a non-infectious cyst. It's enlarged related to that ductal obstruction I spoke about. And the mucus, the inflammation, or the narrowing causes malfunction of the gland itself. Bartholin gland abscess are known as bartholinitis or adenitis, and that's when you see that there is a more acute infection that is present upon your exam. This Bartholin gland cyst is painful. It can be asymmetric, but usually when you see them in your office, they're usually complaining of significant pain. Pain gets even worse when it becomes an abscess. So there's tenderness upon palpation on your exam. They may say it hurts to walk, and there might be dyspareunia present. It may be a chronic or recurrent problem. The Bartholin gland obstruction, it may be unilateral generally, but it could be bilateral at times. The range in sizes from 1 to 3 centimeters, and it's associated with the pain is usually on the side of that infectious process and development of the abscess. Here we have an image of a Bartholin gland. You can see it's unilateral and it's enlarged and bulging, which would cause tenderness with any kind of pressure or friction. Upon your physical exam and diagnostic tests, you want to obtain vital signs to identify infection, inspect the affected area, assess accompanying inguinal node involvement. Where you have infection, you're going to feel maybe enlarged inguinal node on that side. It may be warm to touch. Speculum or bimanual exam may be too painful for this patient depending on their history until the cyst or abscess has been treated. Diagnostic tests include a culture of the cystic contents and also culture of the cervix for any STIs, a CBC for infection. Differential diagnosis for the Bartholin gland cyst or abscess would include identifying any solid benign tumor of the present in the vulva, adenocarcinoma, high-grade squamous intraepithelial neoplasia, carcinomas, sarcomas, mixed tumors, leiomyomas, adenofibromas, mucinous cystoadenomas, mycoid, leiomyosarcoma, papillary tumors, primary neuroendocrine carcinomas. All should be considered before the primary diagnosis is made. Management of the Bartholin gland cyst or abscess is to use an empirical antibiotic treatment targeting both aerobic and anaerobic organisms if cellulitis or fever is present. Surgical treatment involves alcohol sclerotherapy, silver nitrate or CO2 lasers, fistulization, marsupialization, and we'll talk a little bit about these. INDs with or without placement of a word catheter. Excision of the Bartholin gland should be done if suspicious malignancy or recurrent abscess is present, and that's when they will be hospitalized, or referral is definitely necessary to the appropriate GYN or surgeon. So looking at some of these pharmacology management or treatment of the Bartholin gland or cyst, there's a variety of surgical options, but what we see is that when treated with medications, you should see that antibiotic treatment is reserved for those patients with surrounding cellulitis, and it is usually a combination therapy of broad spectrum antibiotics. Carbon dioxide laser therapy, that's what would have the patient also be referred, because they'll go under a local anesthetic, and CO2 laser is used to create a defect from the vulvar skin to the cystic cavity as near as possible to vaporize the cyst contents. Silver nitrate can be used. There's an insertion of silver nitrate into a formed incision, and it's an inexpensive option for treatment. It is effective as traditional excision techniques and has fewer complications and less scar formation. However, chemical burning can occur, and there's evidence to suggest that alcohol sclerotherapy to the Bartholin gland cysts is effective as that of the silver nitrate. So there's different types of options to treat this. Lifespan considerations and complications are the Bartholin gland cysts and abscesses are more common in women of reproductive age. The cyst occurrence often follows an IND or aspiration alone in order to drain that area. Gland excision may be accompanied by hemorrhage, hematoma formation, and trauma to the surrounding tissues. Retrovaginal fistula, scarring may occur in a long healing process, and dyspareunia. So the patient would want to be followed up, or if they're returning from the GYN treatment, you want to kind of investigate if they're having any complications and observe during your PE, physical exam, if any of this is a problem. Toxic shock syndrome is rare, but it has been noted in the literature post-IND of the Bartholin cyst and abscess. Usually treated outpatient, but if it's a systemic infection or a complication occurs, it may warrant hospitalization. So good evaluation is necessary. Refer your patient to an experienced surgeon for therapy if healthcare provider is not comfortable with managing that Bartholin gland cyst or abscesses. But you would probably be first on the scene to know that your patient has a possible Bartholin cyst. Patient and family education include to explain what's going on, what that basic physiology of the Bartholin gland is, and the pathophysiology, to discuss treatment options, to explain what to expect with the treatment and after the treatment. An example would be a CO2 laser therapy patient is instructed to refrain from sexual activity for 2 weeks in order not to irritate, cause trauma, or infection to that area. Post-op discomfort is managed with salt water soaps, expected of 2 to 3 days of that drainage of mucus from the gland itself after certain procedures are performed, and use of proper hygiene should be reviewed, sitz bath soaks, condom use strategies to prevent further gland or abscess formation. Thank you for your attention.